17.2 Mechanism of breathing. Breathing involves two stages: inspiration, during which atmospheric air is drawn in, and expiration, by which the alveolar air is released out. The movement of air into and out of the lungs is carried out by creating a pressure gradient between the lungs and the atmosphere. Inspiration can occur if the pressure within the lungs, intrapulmonary pressure, is less than the atmospheric pressure. That is, there is a negative pressure in the lungs with respect to atmospheric air. Similarly, expiration takes place when the intrapulmonary pressure is higher than the atmospheric pressure. The diaphragm and a specialized set of muscles, external and internal intercostals, between the ribs, help in generation of such gradient. Inspiration is initiated by the contraction of diaphragm, which increase the volume of thoracic chamber antero-posterior axis. The contraction of external intercostal muscles lifts up the ribs and the sternum, causing an increase in the volume of the thoracic chamber in the dorsoventral axis. The overall increase in the thoracic volume causes a similar increase in the pulmonary volume. An increase in the pulmonary volume decreases the intrapulmonary pressure to less than the atmospheric pressure, which forces the air from outside to move into the lungs. That is inspiration. Figure 17.2a. Relaxation of the diaphragm and the intercostal muscles return the diaphragm and sternum to their normal position and reduce the thoracic volume and thereby the pulmonary volume. This leads to an increase in intrapulmonary pressure to slightly above the atmospheric pressure, causing the expulsion of air from the lungs, that is expiration. Figure 17.2b. We have the ability to increase the strength of inspiration and expiration with the help of additional muscles in the abdomen. On an average, a healthy human breathes 12 to 16 times per minute. The volume of air involved in breathing movement can be estimated by using spirometer, which helps in clinical assessment of pulmonary functions. 17.2.1 Respiratory volumes and capacities. Tidal volume (TV). Volume of air inspired or expired during a normal respiration. It is approx 500 ml. That is, a healthy man can inspire or expire approximately 6000 to 8000 ml of air per minute. Inspiratory reserve volume (IRV). Additional volume of air a person can inspire by a forcible inspiration. This averages 2500 ml to 3000 ml. Expiratory reserve volume (ERV). Additional volume of air a person can expire by a forcible expiration. This averages 1000 ml to 1100 ml. Residual volume (RV). Volume of air remain in the lung even after a forcible expiration. This averages 1100 ml to 1200 ml. By adding up a few respiratory volumes described above, one can derive various pulmonary capacities, which can be used in clinical diagnosis. Inspiratory capacity (IC). Total volume of air a person can inspire after a normal expiration. This includes tidal volume and inspiratory reserve volume (TV plus IRV). Expiratory capacity (EC). Total volume of air a person can expire after a normal inspiration. This includes tidal volume and expiratory reserve volume (TV plus ERV). Functional residual capacity FRC, volume of air that will remain in the lung after normal expiration. This includes ERV plus RV. Vital capacity VC, the maximum volume of air a person can breathe in after a forced expiration. This includes ERV, TV, and IRV, or the maximum volume of the air person can breathe out after a forced inspiration. Total lung capacity TLC, total volume of air accommodated in the lungs at the end of a forced inspiration. This includes RV, ERV, TV, and IRV, or vital capacity plus residual volume.